Welcome everyone to the Eugene City Council May 20th work session. We have two items today. The first one up is the City and Lane Regional Air Force Protection Agency Partnership. And welcome.
Thank you, Mayor. Go ahead.
City Manager?
Hi, I'll start off.
Okay.
The last time we met on this topic, the subject line was really very specific around safe demolition, and so I wanted to just give you a few updates on things we've done since that work session that has led to this. And in that last time, you had directed us to move forward with some updates to how we do demolition in Eugene, and you also wanted to have a conversation with LRAPA about our kind of areas of mutual interest and how they might also interact with this topic. So since that time, in March of this year, we changed some of our admin rules, and I know we've sent you an email, but I wanted to just go ahead and let you know again, which significantly changed some of our demolition practices to restrict demolition when winds are over 25 miles an hour. We require now that when people get an application that they have provided notice to the adjacent property owners that they intend to do the demolition. And we have stopped allowing any kind of implosions without a special permit that would deal with health and safety livability issues. Assume those are probably pretty rare. We've also changed our rules to include requiring a demolition plan. So in addition to getting the permit, applicants have to tell us how they're going to go about doing the demolition and what kind of measures they're going to put in place to protect safety. We've put a system into place that we're just starting that notifies LRAPA when we do get a permit, and we've approved it so that they know where the site is and what the contact information is in case there's issues that come up. And then lastly, I know that Stuart Ramsing was working with Councilor Brown on the idea of having some fact sheet best practices, easy ways for owners, contractors to understand what the rules are. So there's a draft at your seat, and we're still working through this, that really is a practical guide for how you might do demolition in Eugene. It includes regulations, regulatory agencies, best practices, resources, and is something that will be available online in the full document, and also a smaller, shorter version that people can pick up. So taken some really active steps to improve how we do demolition, especially given how we're going to grow and develop Eugene. So with that, this is an opportunity for Merlin Huff, who's the director of LRAPA, to talk more about what he does, and then we can just have a conversation afterwards.
Thank you very much.
Thank you, Mayor, Council. There were a couple reports of LRAPA put in your board packet, and those are reports from recent meetings of the LRAPA Board of Directors. Currently, you're probably all aware that Councilor Betty Taylor is on the LRAPA board. A few years before that, Councilor Claire Sorette was on the board, and before that, long before that, Councilor Betty Taylor was on it for several years back then in that day as well. So it's a pleasure to be here. I will be using a few of the key tables and graphs that are in that background information, but I wanted you to see it in the reports themselves for the context. Well, we have, as you know, we have a large county. Even though we are a single county jurisdiction for LRAPA work, it's a large county when you compare it to other parts of the country, as big as Connecticut, for example. Here within one county, we have multiple airsheds that are in either attainment or non-attainment or in maintenance, which is the case for Eugene. In Eugene, the areas are in maintenance for particulate matter 10 microns and smaller. It's a maintenance area for that. Had a problem in the past, has been in compliance in recent years. For carbon monoxide, that had been a problem back in the 70s and 80s, but that's been well within standards in recent years, so in what we call maintenance category. Just a quick history review. LRAPA was formed by intergovernmental agreement back in 1968. The original three partners were cities of Eugene and Springfield and Lane County. In the early 90s, by that time, Oak Ridge and Cottage Grove had also joined the intergovernmental agreement. We, with our partners, have been very successful in meeting air quality standards on schedule here in this area, and that's important not just for protecting public health and protecting the environment, but also for economic development, because it's easier for businesses to locate or expand here if we are meeting air standards. Here's our vision and mission. This was developed, last time it was refined, I think it was back in 2006, but it establishes the general direction for the agency. We organize our work under four major goals. Certainly air quality is a key, and we've been successful in meeting air quality standards on schedule. We're still have an issue up in Oak Ridge with the newer, tighter standard up there, but other than that, we've been remarkably on schedule or ahead of schedule in meeting air quality standards. As far as involvement, key reason for having a local agency is that there's more local control and direction and more involvement of citizens and elected officials in the area. As far as service, we consistently get high scores on the surveys we do with our stakeholders as far as the service and the timeliness of the service they receive. And as far as partnerships, as a small agency, we're currently only about 15 staff. As a small agency, it's especially important that we partner with others, leverage our resources, and we've been very successful in bringing grants to this area for businesses and schools and communities that far exceed the amount of the local investment. Air monitoring network is one of our strengths. If you compare us to Salem, a similar size population area, we have a much more extensive monitoring network. Generally, the folks want more monitoring rather than less, and it's also very helpful for us being able to assess our progress over time. So you can see the stars in the Eugene-Springfield area. That's where most of the sites are located, but we also have sites out in Oak Ridge and Cottage Grove, and perhaps the most surprising one is Saginaw. We have Saginaw because it's the right distance downwind from urban area for monitoring ozone on the hot summer afternoons. So we measure ozone in South Eugene at the Amazon site, but we also measure it down at Saginaw. They track pretty closely together, but Saginaw is the one that best meets the siting criteria for monitors for ozone downwind of urban areas. Carbon monoxide is clearly a success story with primarily with cleaner vehicles and cleaner fuels, but also smoothing of traffic flow through computer signalization. Anything that reduces congestion and smooths traffic flow also helps to reduce carbon monoxide. So we used to measure that primarily at downtown where the old LCC building was, near 11th and Willamette. But even there, we've discontinued because we're so far below the health standards. We'll be doing a spot check this next year as part of some other monitoring we're doing. Ozone has more noise because it's summertime pollutant. It depends on how many hot days we have, especially hot days with slow wind speeds. And so you can see that it varies, but clearly a downward trend, and we've been able to stay ahead of the tightening health standards. As more and more health studies are done, there's a recognition that the standards need to be more protective, but we've been successful here in staying ahead of those tightening of standards such that the Eugene area has never been non-attainment for ozone. The key issue is particulate matter, and you can see from the big picture here, looking at the 30-year pattern, that we've been remarkably successful in improving levels of particulate matter. In this case, it's a graph of the respirable particulate. That's the 2.5 micron. This is what's clearly down in the smoke category. Larger particles are generally not as much health concern, and those would be generally larger than 2.5 microns. So this would be primarily the smoke part of particulate matter. As you can see, we met the standards that were in effect in the mid-90s to 2005 period, but the standard was tightened. It's hard to see on this graph, but that red dashed line is the tighter standard that's currently in effect, adopted in December 2006. Initially, it looked like we were going to be very touch and go here in Eugene as far as meeting that standard. But as we got more and more years of data and further improvement, we had a little bit more margin of safety. But in recent years, we're still on the right side of the standard, but we've had some elevated levels the last couple winters because of combination of the cold weather and stagnant air periods happening at the same time. This is the end, basically, on that last 10 years. And this allows you to see that at the two key Eugene sites, both out Highway 99 and also Amazon Park, that the levels have been higher. These are 3-year averages, so it kind of dampens the fluctuations somewhat. But still, when you look at the last 3 years, the 2 data points there on the graph cause us to regroup and refocus efforts to be sure that we're staying within health standards. This gives an idea of some of the various air quality issues that we're involved with. This is a summary of our complaints for the last decade or a little over a decade. A couple patterns. One, just looking at the bottom line, we used to have over 1,000 complaints, and we try to respond to every complaint. We had over 1,000 there in the earlier years on this table. It's been in the hundreds in recent years. The 2 main changes have been field burning. When field burning was banned in 2009, that sharply decreased the number of complaints. And in that case, we forwarded those complaints to Department of Agriculture, so they weren't as much involvement as far as response by our staff. But that changes the numbers on this table. The other one is industry, and that was especially high in the early years on the table due to the many complaints we were getting on Baxter. And there's been a series of improvements that have been employed there, and that's dramatically reduced the industry complaints. So it's not just Baxter, but that's the big reason for the big numbers in those earlier years. On the flip side, the 2 categories where we've had increasing complaints have been homewood heating and also outdoor open burning. So those 2 generally have been on an increasing trend. And so we'll be expecting to have further conversations with all of our partners on those 2 issues in the next year or so. As far as the work we do, as far as its interplay with local ordinances, we essentially are implementing ordinances on behalf of our partners. Those are city or county ordinances. And a couple of years ago, the county commissioners invited us to a work session here in this room, and we had spent a fair amount of time working with our partners to try to quantify how much time, how much of our resources at El Rapa we put into various parts of our jurisdiction. And we broke those down by different categories. Now, monitoring, the first line, even though we do more than, say, a comparable area like Salem would do, if El Rapa wasn't doing that, then the state would have to. And so we also, the bottom line here takes out monitoring. So that's just looking at ordinances implementation, other complaint response, the progress reporting we do on all of our attainment and maintenance plans. And so when you look at the bottom line for the area, if you include monitoring, it's about 680,000 of resources are invested in those programs. If you take out monitoring, it's just over 300,000. And just to compare it, currently the dues are, from all of our partners, local dues are 120-some thousand. I think Eugene's about mid-50,000. So in all cases, the resources we're able to leverage using state, federal, and other funds, we're able to provide more service than the actual dollars amount of the dues generated locally. This is just a bigger print of some of the numbers. With a little emphasis on Eugene. With monitoring, about almost 252,000. Without monitoring, just under 100,000. And but that's a little bit easier to read than that table. Although the table, if you have a chance to look at it, it provides a lot of information when you slice it and dice it different directions. Okay, let me talk just about a couple programs related to demolition activities. That's why I chose these two. These are just two examples of many programs that LRAPA implements. But if you look at asbestos, it's a special concern because it's considered a hazardous air contaminant. It has a special section under the Federal Clean Air Act, Section 112, that identifies requirements that have to be implemented. So we basically implement that and somewhat more here in the local area. A few definitions, just to, asbestos comes from a variety of different mineral types. Some are more health concern than others, but generally as a category, it's a high concern because of the mesothelioma and other well-documented things over the years. Now, asbestos is a remarkable material. It has a lot of wonderful qualities, and that's why it's been so widely used until those health concerns were realized many years later. So you see it in quite a few products. Asbestos abatement project includes demolition, but more commonly it involves renovation or remodel work that's occurring in commercial buildings or in homes. Asbestos-containing material, that's specifically identified. There's a very specific method for identifying that, quantifying that, and if it's more than 1% asbestos, then it's considered asbestos-containing material, and so then it's subject to many of the requirements that are part of that Title 43. That title is many pages, so this is just giving a kind of the briefest overview of what that section addresses. Now let me touch on fugitive emissions. These are a little easier to summarize than the asbestos requirements, but basically it focuses on getting reasonable measures applied that would minimize fugitive emissions to the greatest extent practicable. And in the rules, it applies essentially to all sources of fugitive emissions in the county except for agricultural activities that are specifically exempted by state statute. So examples of sources affected by the rules are, well, the first three I emphasize. Demolition is one of those, but more commonly construction and unpaved traffic areas would probably be the biggest on that complaint table. Those would be the biggest numbers. We typically have just a few to a handful of demolition-related complaints. Most of them are involving construction or unpaved roadways or yards. So the general requirements are to take all reasonable precautions, and those reasonable precautions, we list a number of those here. The first two on this page, using water or chemicals to control the dust. Sometimes it requires asphalt or road oils or other chemicals to adequately control the dust. If you have material stockpiles, sometimes those will require enclosure in order to prevent dust problems. In the handling of materials, hoods, fans, fabric filters. Sandblasting requires special containment to prevent problems from that. Open-bodied trucks can be a problem if they're not properly covered, if they're transporting dusty materials. And then the last one is especially important, prompt removal when you have track out. What begins as mud, well, it'll have its safety issues as mud, but if it's allowed to dry, to stay and to dry, that can be re-entrained with traffic and become a significant dust problem later. So this is coming back to the complaint table, but just more as a reminder that those are just a few of the programs that we're involved with implementing or responding to complaints. So in summary, it has been the goal of having a local air agency through an intergovernmental agreement has been successful. It's been a more effective and efficient way to handle multiple city and county programs involving air quality. We've been together, we've been remarkably successful in meeting standards on schedule, and achieving standards is important not just for public health, but also in environment and economic development. With that, I'm done. If there's questions, or if Sarah or John want to add anything.
No, I think it's really just an opportunity to dive in, ask questions, and see what else you'd like to learn.
I have Mike in the queue. Is anybody else in the queue there?
George.
Anybody else? George?
Thank you, Mayor. Thank you, Merlin, for the presentation. That was very nice. That was good. I also appreciate that with some of the questions that were raised after the demolition issues, that we're able to clarify some of that work and understand that a little bit better. Would you mind bringing up the complaint table just again for me for a second? I don't see cigarette smoke on there. Do you get those kind of complaints?
We may get the complaints, but they're not within our jurisdiction, so we don't. We forward those to other folks. Indoor air quality is not part of the authority or the responsibility that we've been given.
So why is it you don't regulate cigarette smoking outdoors in Lane County?
Well, the primary, if we go to our mission and vision, we're trying to protect against air quality standards. Those are generally defined at like a neighborhood scale. So as far as the one-on-one type, that's narrower than our scope of responsibility.
I appreciate that I'm asking you questions not as a part of your presentation that are off kind of the point of what you came to talk about, but it's in keeping with some of our discussions, and I thought I'd take advantage of the fact that you're an expert and we had you here. I see looking ahead that it looks like we may get a staff presentation that may indicate that outdoor smoking is in some way a health hazard, which my understanding is it's absolutely not. Can you perhaps enlighten me on that? Secondhand outdoor cigarette smoking, does that present people a health hazard?
I'm not an expert on that, and I'd hesitate to even try to respond. Sorry.
Can you talk about dispersal rates, outdoor air versus indoor air and particulate?
Well, what we find when we model or measure air pollution, that as you get a distance from the source, that it reduces by at least the square root of the concentration when you're very close. So it does. You can model that dispersal as you get further. So certainly, the closer you are to the source is most critical. The further if it's twice as far, it's usually much less than half.
It's exponentially
right.
less of an issue.
Right.
Okay. Thank you, sir, very much. That's very helpful.
Further. For me?
Yep.
Oh, sorry, I didn't hear you. Thanks, Merlin, for the presentation, and I appreciate the update. I was curious, since we were talking about or some of the reason that spurred this additional conversation was around our demolition codes. How would complaints related to a particular construction site be categorized in your spreadsheet of complaints?
Well, it depends on how it's described by the complainant, but construction site would typically be described as a dust problem and would end up in that category. So most of what we see up there in dust are probably those construction sites or unpaved roadways or yards, but demolition would also be in that category.
So most likely as dust. If the complaint was generated by, let's say, idling diesel fuel trucks or something along those lines, is that the kind of complaint your office would field as well?
Yes. Yes, sometimes we have more ability to solve the problem than others. Certain mobile sources, motor vehicles or railroads, et cetera, if there's interstate issues, some of those are delegated to EPA because of the interstate nature of those. So sometimes we have fewer tools in the toolbox to work with sources of problems like that.
And then I was just curious if you had any reaction or opinion about the updates that we made to our administrative rules regarding safe demolition, and if you thought those would be updates that other communities might want to consider if they haven't already in terms of improving or mitigating the negative impacts of demolition on surrounding community?
We thought those were very pragmatic, straightforward additions. The notification, the wind speed recognition, and the implosion is rare. I don't know that I've ever observed that here locally. But those all looked very useful, and I think they will generate conversations with other partners as they become more aware of what you've done here. We're just starting to look at the draft document, so I can't, it looks like it's helpful to put all the information in one place. We certainly appreciate all that the city does to direct folks to us when they're doing a remodel or some other project where an asbestos survey might be necessary. So we certainly appreciate all those folks that, if they weren't already aware of our requirements, that get steered there as a result of talking to the city.
And then since you mentioned the draft handout that we're working on, I know you guys give out you have a lot of pamphlets, you give out a lot of information. Might this be something you stock at your agency as well?
Yeah, I would expect so. Yeah, we have a rack right there at the entrance, as well as the folks involved with the different programs have those things at their fingertips. It's nice when these days frequently things are so available on the web. If somebody calls or emails, it's nice to be able to give them a link to that same information.
Great, thanks.
George Brown?
Thank you, Mayor. Yes, thank you very much for the updates and the presentation. It's helpful, I think. But I kind of want to turn to this document, which looking over, and I like it. And I want to get a little more specific about our safe demo practices, which LRAPA doesn't really have much of a role with. So I really like this. This is great. I think it covers almost everything. I have questions. On 1, 2, 3, on page 4, I guess it would be. It's not. No, page 3. Sorry. Under key questions to answer, these are mandatory. Is that correct? At the time of, and then I see on page 5, under to apply, to submit for a permit, bring 3 copies of the demolition documents to the Permit and Information Center. I'm assuming that the demolition documents refers to key questions to answer. Would that be correct?
Yeah, I'm going to, Mark Whitmill, our building official, is here to answer more specifics about
Okay.
building permits plan, so I don't know if you want to jump up here.
So if I understand, the question is if the answers to these key questions are required to be submitted as part of a permit application.
Yes.
For the most part, yeah. If you look there's a section on applying for a permit. Starts on page 4. The things we're looking for in terms of documentation are a physical site plan, a drawing that shows the location of the building to be demolished, proximity to other structures, location of pedestrian ways, those sorts of things. And then we're also asking that there be a demolition plan, which is could be a narrative, more a plan of attack that addresses answers to those questions. So how are you going to measure wind speed? If pedestrian protection is required due to proximity of the demo to pedestrian ways, how is protection going to be provided? Are there any special methods or means that need to be in place to protect adjacent structures from damage, those sorts of things?
Okay. All right. Thank you. So let's go back to page 3, key questions to answer. It says right under that, it says, before beginning any demolition project, you should consider, not you must, and be prepared to answer the following questions, answer the following questions as part of your demo plan before you get your permit. So I guess my question is, are these key questions, are these mandatory? Because it doesn't read that they're like you have to do this as part of your permit application.
Sure. The things that are mandatory in terms of the building permit approval are just the things covered under our scope of administering the building inspection program. So the first key question to answer is, how will the spread of dust be minimized? Well, that's outside of the scope of the building code, but within the scope of LRAPA's work. So since this is intended to be kind of comprehensive of pulling together all the things, all the regulations that apply and all the things that need to be involved, that's a question they need to be thinking about to meet the regional air quality requirements. It's not a question that they have to answer to get a building permit.
Okay. See, I think this is part of the problem, personally, because there's no requirement for them to submit answers to these questions to LRAPA. There's no accountability here. It's like, well, just think about these questions, and no one's going to ask you what the answers are. LRAPA won't. The city of Eugene won't. So maybe the water is not being applied properly. Maybe there's, maybe none of these. Who's to say? Why should I even worry about that? If you see what I'm saying, it's not codified. When I met with Stuart Ramsing a few weeks ago, I told him about my conversation with Michael Braverman, and asked him to consult with him. He's the Deputy Commissioner for Housing in the city of Baltimore, and he also oversees he's in charge of compliance with their demo protocols, which are codified. And
George, you're over.
yeah, I'm going to need at least 2 more rounds, probably. Thank you.
We'll do the best we can with that. Alan?
Yeah, Merlin, this is probably for you. I have a more general question about the dramatic decreases in the air pollution locally over the past 20, 30 years, specifically the graphs you showed about carbon monoxide, ozone, and particulate matter, PM 2.5. What do you think really accounts for this? Is it regulation spurring new technology that has decreased it, market forces? I mean, on seeing the field burning complaints, that's clearly regulation banning it, but it wasn't market forces at all. But what do you attribute to these dramatic declines?
For particulate matter?
Well, all 3 of them had pretty dramatic declines over the last 20, 30 years.
Well, it's a different, little bit different approach for each one. For particulate matter, the wood products industry historically, maybe even before this graph, were a big part of the emissions picture. Back in the 1970s, there was a resurgence of wood for home heating with rising energy prices. So across Oregon, those increases in home wood heating were negating the progress that had been made from phasing out wigwam burners or tighter boiler controls on wood products industries, et cetera, that sort of thing. So the biggest improvement on this graph, this time period, has been progress on the home wood heating. Back in 1983, Oregon adopted the first wood stove certification program in the country. It became the model for a national program a few years later. Curtailment on red days, or even just getting out the information, the red, yellow, green information, so people know which days are no restrictions on burning, yellow days when they should avoid wood burning if they can, or at least burn less, or be more conscious of clean burning practices, and then red days when they should stop burning entirely, unless they were in that narrow group that had exemptions for that. Firewood seasoning programs, education, outreach just on proper firewood seasoning, but also operating smaller, hotter fires. Don't try to damper down your airtight stove overnight for convenience, but rather keep it in a more clean burning phase. Mm-hmm. All of those things. But that's probably the single biggest program on this graph, and that's still the focus up in Oak Ridge. Oak Ridge is a little bit more like a laboratory up there. You don't have any of the confusion of other sources. You don't have any industry that's complicating things. It's just all wood stove fireplace use. Ozone is, motor vehicles are a key part of that one. They're probably still about half of the emissions that contribute to ozone formation. Ozone's more complicated. It forms, it's not emitted by sources, it actually forms downwind, oxides of nitrogen and volatile organic compounds. Oxides of nitrogen or any combustion source, but cars have been a big part of that. So as we've got cleaner cars and cleaner fuels, cleaner trucks, that's helped on that positive trend. With air toxics requirements on industries, we've seen a big co-benefit, reducing the volatile organic compound side. Things like house painting, any painting, but like even house painting or consumer products are part of that. There's been national efforts, and there's kind of the national effort, and then there's the California effort because their problems are so much more severe in California. And we're getting the benefit of both of those, partly because of our proximity to California, but we certainly get the benefit of the national program. So anything we do on industries, there's primarily since 1990 a series of things to reduce air toxics by industry sector. And they're primarily to reduce air toxics, but we're also seeing co-benefits for the things that contribute to ozone. And then if you look at carbon monoxide, that's about as pure a transportation problem as you're going to find. Anything that helps cars be progressively tighter pollution control equipment on new cars as those cars replace older cars, cleaner fuel requirements over time, and then anything to smooth traffic flow. But that's pretty much a pure transportation issue, and those levels were highest where you've got heaviest traffic congestion, because slow speeds are also a problem.
Yeah, so on these public goods like air quality, there doesn't seem to be market mechanisms that really react to this. It's following the regulation that causes the decline, which causes people to get better technology and move down the path towards cleaner air. What's the role of market forces in all of this?
Well, that's a good question. There's been more emphasis in recent decades on how do you put those into effect. So it's not so much a command and control, regulatory approach, but you're building in incentives into that. One of the examples right now would be electric vehicles. Incentives to get more electric vehicles out there sooner. So right now there's a federal tax credit. The state legislature is considering adding a state rebate to that to help speed up that process. We're encouraged by the numbers of electric vehicles when you compare it to how fast hybrids, that are so widespread now. But you compare back to the early days of hybrids, it's actually quite encouraging what those incentives are doing to get more electric vehicles out there. Here in Oregon, especially Western Oregon, we're the envy of many parts of the country because of the infrastructure we have. The West Coast Electric Highway. I'm parked in the Parkade building at Electric Charger right now with our the electric Fiat that we're leasing for the office. So Western Oregon is the envy of a lot of the country for the availability of that infrastructure. So I think we can build on that more quickly here because that infrastructure is largely in place.
One final comment is thank you for not saying close proximity, both you and Mark.
So I intend to switch to our next topic in 5 minutes. I'm just giving everybody warning about that. Want to be sure that I give George polling. Did you have any questions? Greg, you have any questions? Betty.
Thank you. First, I just want to have something to say. I served on the Lane Regional Air Protection Agency, and we had a decision to try to always say that at one time, so that instead of just Alrapa, and it used to be the Lane Regional Air Pollution Authority. We changed it to a kinder, gentler name while I was on the board, but it has still Alrapa, but we made a great effort to say the whole thing. We also bought a building while I was on the board previously, which is now paid for, Merlin tells me. And I just want to say that Merlin I've just recently returned to the board, but from all I could see, he's doing a good job, and I haven't heard any complaints. we had a whole series of directors for a while, one after another, and he seems to be staying, which is good. My question is, do you get many complaints about auto emissions?
Let me pull that table up there. The motor vehicle emission complaints that we would get would be small enough that we put them in that miscellaneous category. So they're a subset of that line that's called miscellaneous. We do get smoking vehicle complaints. There is a state statute that can be enforced by local police as well. But that's not a high priority for local police. Sometimes it's cited as one of multiple violations that they observe. We have a letter that we can send. At least in Western Oregon, it's an interesting statute that it's applicable in Western Oregon. But we can send a letter if somebody reports a license plate with smoking heavy emissions, and we can alert them that we've received a complaint on that and asking them to work with their mechanic to solve the problem. But not big enough to have their own category on this complaint table, but it's a part of that miscellaneous category.
Thank you. I think we'll be talking about that at the board later.
Yes.
Okay, George.
Thank you, Mayor. When we first started addressing our lack of safe demolition practices 2.5 years ago, it's been 2.5 years. I think we did it because we all, the mayor and all 8 councilors, share a concern of protecting residents and visitors from the harmful effects of breathing lead dust and particulate matter. Am I correct? I mean, would anyone object to that as our goal? Just head nods would do. So we're all agreed on that. Our main consideration is protection of children, pregnant women, old folks, people with respiratory problems, people with the immune system problems, that inhalation of particulate matter and lead dust will be very harmful for. That is our main goal. Well, this is the product after 2.5 years. And this is a good product, but it's not put together right. We're going to need another session on this because we're really not there yet. Because these key questions to answer, who asks the questions and who do you answer to, it's not specified. It's not the city of Eugene. And then best practices. Well, these are best practices. Think about it. There's no requirement to do it this way. These things need to be moved over here into applying for the permit. Now, the manager's 2016 proposed budget, which has been approved by the committee, there's a new plan reviewer. Am I correct? A new plan reviewer has been added back, and I believe one other person in planning and development has been added back. So we will have somebody who will be able to do that, because it doesn't happen every day. And yet there's 3 very important demolitions coming, remediation/demolition projects coming up real soon. One is over at the restaurant and credit union building in preparation for the big grocery store going in there. That's on a busy street, nice weather. People are going to be cruising by with their windows down. They're going to be inhaling any dust that escapes from the site. There's the McHale's Cleaners between a grocery store and the library across the street from the bus station, and there is the mortuary at 11th and Olive in preparation for the Hilton project. That's in close proximity to many thousands and thousands of people every day, as well as all the new residences, Olive Plaza, and at Capstone and Olive Plaza, the library, the bus station. And this does not protect them from improper remediation or demolition. We're not there yet. We're really close. This is a really good document, but we're not there, and we need to talk about it some more.
what I would say is we've heard you say that, and what we will do is go back and take a look, and particularly with respect to those questions, and see if there's a way to bring them back into the required versus suggested. So we will.
Call Michael Braverman.
So we'll take your comments and go back and sort of relook how some of that might work.
Call Deputy Commissioner Braverman. He'll help you with that.
And the other thing I think I heard in that is to the extent that you can reference who's responsible for that and why people have to comply with those things. And if it's not already in some way in our code or required by LRAPA, then tie it to something else, I think is what we heard.
So we'll go take a look at all of them.
Thank you very much. Okay, we're going to move from thank you very much. Appreciate it. Next up is healthy downtown and public smoking. The manager?
I'll turn it back over to Sarah.
I'm just going to take this air quality thing one step farther until it's going to be popular. So Renee and I are here today to kind of present the big picture policy. There's a lot of people in the audience, our partners from Lane County Public Health and some consultants we've been working with and others that may need to come up and answer more specific technical questions than I'll be able to answer. But I wanted to just introduce this topic because the downtown policy team, which is really consists of me and Renee and Chief Kearns, Christy Hammett and Laura Hammond have been working on, a set of different strategies that will continue to make downtown healthy, vibrant, livable. And so the cigarette butt smoking and livability issue actually came up in 2010, a long time ago, when we were a group of execs took an afternoon off and walked around downtown picking up cigarette butts, introducing ourselves to downtown business owners and asking were there things we could do to put in place that would make it easier, because it seemed as if there was a lot of trash and receptacles related to cigarettes. So that's kind of where it started. And I think, for me at least personally, when the county came and presented the Community Health Improvement Plan and started to put out some of the numbers about the number of people in Lane County that die due to tobacco smoke and complications of that, we explored whether there was an opportunity that we could work together and solve a couple of different problems. So that's really where the beginning of the partnership began. Renee's going to walk through some of the work we've done, some of the things we've learned, throw out some ideas. There's no decisions to be made today. It's really more of a discussion to see what next steps, if any, you would want to take.
Okay. Thank you. I think this is on. All right, there we go. Sarah, can you give me the next slide here? There you go. Or give me the next slide. I'll go back here. Just as Sarah said, we're going to give you a little background, identify some of the things we've learned in the last couple years, outline some considerations and options for you to think about, and next steps of where we think we should be going with this, and then we'll have time for some answers to the questions. Just a little history on the background of actions that have been taken prior to today. In 2000, Eugene was the second city in Oregon to ensure that everyone was free of secondhand smoke in the workplace. That includes restaurants and bars. And it eventually led to the statewide ordinance of a smoke-free workplace law in 2009. Also in 2000, Eugene adopted a youth access to tobacco ordinance, which ensured that youth under the age of 18 could not purchase tobacco. Interestingly, 9 out of 10 smokers start before the age of 18, and 99% of smokers have picked up the smoking habit by the age of 26. So you can see the importance of the youth prevention piece. In 2005, the Clean Indoor Air Ordinance was updated to create a 25-foot buffer free zone around publicly owned buildings. And then in 2010, an ordinance was adopted for completely smoke-free city-owned properties where children are the primary service or are served. That you would recognize that by the Eugene Public Library community centers in the services that we're providing. So we have a history of really leading this charge. One area where we're really not keeping up with the rest of the state is smoke-free parks. And that is something that, and open spaces, and that's something that you'll be hearing more about as we move forward this summer. All state parks are now smoke-free. 18 cities, 10 park districts, and 5 counties in Oregon are also smoke-free. Our Parks and Open Space Division, in collaboration with our policy team, will be presenting options for the community to comment on in July with the hopes of presenting something, smoke-free parks in September. So that will be coming before the community at that time. So just some statistics around the tobacco impacts on our community. Tobacco is a leading cause of preventable death in our county, country, and state.
Smokers? That's what you want?
Tobacco is the leading cause of preventable death. In all areas. Tobacco causes approximately 7,000 Oregon deaths each year, and 700 people a year in Lane County alone. An additional 600 deaths are caused by secondhand smoke each year across the state. Surveys indicate that 75% of Lane County residents believe it's important to be protected from secondhand smoke outdoors. 20% approximately of Lane County adults smoke cigarettes. 80% want to quit smoking cigarettes, and slightly under 60% tried to quit last year. Don't know that they were successful. They tried to quit. Because of the significant toll of tobacco, tobacco prevention is one of the top 5 priorities, as Sarah mentioned, of our countywide community health improvement plan, or the CHIP you may have heard it referred to. So we've been partnering with Lane County Public Health to learn more about what we can do here, what other communities are doing, and strategies to address this issue and best practices around that. The county was the recipient of a grant funding from the state as part of the Tobacco Master Settlement Agreement. With the aim of the funding was to advance policies, systems, and environmental changes that promote tobacco-free environments, communities, reduce the influence of tobacco product marketing and promotion, and to encourage tobacco users to quit. So as part of that grant, we wanted to get a better understanding of the impact of smoking in our downtown in particular. Lane County Public Health and Reed Group, a consultant that's been working with us, conducted an observational study and key informant interviews. And as you can see on this map, we observed a 4-block by 4-block area between 11 a.m. and 11 p.m. on 2 days in the fall of 2013. As you can see, the intersections of the bright orange or the orange circle are the more significant use areas that were observed, and it goes down in size. But you can see that where most of the smoking events were observed. In total, 551 instances of smoking were recorded, about 1 every 2 to 3 minutes during the observation time. On average, the equivalent of smokers tended to be young, between 18 and 30 years old, and male. Of those smokers that could be identified, 80% were customers and 20% were employees. And as you can see, the most common area that smoking was occurring was around the LTD Eugene station. A number of stakeholder interviews were also included. Downtown stakeholders included business owners, Chamber of Commerce, event and venue organizers, and neighborhood association leaders. In general, there was more support than opposition to create smoke-free areas. Some respondents had strong opinions that new regulations should include designated smoking areas. A number of social service agencies were also interviewed and talked about what they thought of of pursuing this. Social service agencies are concerned about equity in our community. Agencies such as Shelter Care, the Eugene Mission, Food for Lane County, the Dining Room, Looking Glass, Whitebird, Calc. The list was very long and very inclusive. There was general support, but concern about equitable enforcement. That was their primary issue. And some of the agencies do provide cessation support. So that was something that we heard very strongly that was an option as we move forward.
So I'm going to talk a little bit about what we've learned. When we first started this process, one of the first questions we asked is, what other cities are out there doing something like this? Are there other cities that are trying to have healthy downtowns, healthy parks, and really, what can we learn? And at the beginning of the process, there actually weren't very many, and it's really something that's picked up a lot over the last couple of years. So what we tried to do was look at other cities that are similar in size to Eugene, that may have similar kind of town-gown relationships that people will often point to as being kind of like us, and to see what their stories were. So one of the communities that were surveyed was Boulder. Boulder, very similar to us, were very focused on health. They did a very lengthy education outreach process. They partnered with public health, just as we would be proposing. Did a lot of work on cessation, especially for the downtown employers. They also worked really closely on with public safety on equitable enforcement. This is a concern that will keep popping up across all of the cities that we talk to, and really focused on education over ticketing. I can't remember this. Okay, I'm going to go back. Sorry, I couldn't remember if that lit up. If you've been to Boulder, this is really kind of the Boulder Mall area. They started pretty small with some kind of small boundaries. It was very popular, and so over time they've been able to expand the zone as people have asked for more distance. They don't have designated smoking areas. It's a 24/7 ban, and they exempt private automobiles. So if you're driving through, obviously there's not that. They have a very comprehensive program. It includes cigarettes, it includes e-cigarettes, vaping. It also includes marijuana, because, of course, marijuana is legal in Colorado now. And what we learned from them, it was really important to build a coalition, which is very similar to some of the work that we've been doing. Fort Collins, which is just up the road, a little bit of a similar story. They're kind of in the beginning of theirs. They also started small, really based on a lot of public interest. Built a coalition, and they really wanted to start, their council wanted to start on their just city properties, so they decided that all of their city properties, municipal properties, parks, and open spaces would become smoke-free. That actually starts, I believe, this September. And what they learned through that was that people had an interest in the downtown also being smoke-free, and so they have proposed an area that'll go smoke-free starting in January of 2016. Similar, it's a 24/7. They're not proposing any designated smoking areas. Before we get a little closer to home, another, don't have a slide for it, but another community very similar to us, Burlington, Vermont, has done the same thing, started small, and it tends to be growing. So you can see this is something that is not, we're not the first. A little closer to home, last year, some of you passed around some information about this last year, that Salem passed an ordinance that essentially prohibits smoking on city-owned sidewalks that are adjacent to properties declared as non-smoking by the property owner, such as Willamette University and Salem Health. So what that rule stated was that the property owner must request the smoking prohibition from the city, and that they must have 100 feet of city-owned sidewalk and meet the public services definition. So this was more of an opt-in policy, that you were authorized to do it if you asked for permission, you had a public of that. So that's Willamette University and their transit district have taken that. And we know from conversations with the University of Oregon and Lane Transit District, this is something that they might also be interested in. They are now also looking at making all of their properties, city properties, smoke-free, and I think they have a public hearing on this item next week. Right here at home, University of Oregon, of course, went smoke-free in 2012. They really wanted to encourage tobacco users to quit, and that included their students, their volunteers, faculty, staff, everybody. It includes all of their buildings, their athletic and entertainment facilities, sidewalks, roadways, parking lots, and grounds. Also includes e-cigarettes and private automobiles on site. They do have issues with people smoking along the edge, which is why we think they might be interested in an opt-in policy. Oh, I guess that was the map. Sorry. So, what we've learned from this is the things that we need to be cautious of is first and foremost the equitable enforcement plan, that in no way is this an issue to be about behaviors, that it's really about the smoking behavior, and trying to create an environment that is healthy for everybody and welcoming for everybody. We've know that it's important to engage with the social service providers. We've done that, and we've made a commitment that any enforcement activity, or how we craft that, or how we'd even go forward with it, we would work with them before we brought it to you. Public education and outreach. We know that the messaging and partnering and making it really clear that everybody deserves to be downtown, and everybody deserves to smoke, to breathe clean air. Everybody deserves to smoke. That we have really clear boundaries, and we need to understand what those options are on the perimeters, but we don't want to have a situation where we have multiple, patchwork of properties, or, confusion about where people can and can't be. We would probably want to consider how comprehensive to be. Does it include tobacco, combustibles, electronic cigarettes, maybe marijuana? And also really important to provide cessation support for downtown employers, for anybody that is using the downtown on a regular basis. We would want to be able to do that and partner with the social service agencies in Lane County to do that. Options going forward, again, you don't have to make any decisions today, but I think what we're talking about is, one option is to create a smoke-free zone in downtown. It could be the sidewalks, could be publicly owned areas. The definition of what that is could be to determine. Could be an option. We might want to provide an opt-in option so that places like the University of Oregon, Lane County, LTD could also opt in. One option would be just to start with our own properties. As we talked about, coming to you later this year will be parks and open spaces as being smoke-free. So that could be a good starting point as well. So our next steps are really to continue working with the policy team, to continue working with social service providers in Lane County on what an equitable enforcement plan might be, so that people felt like this was fair. We need to get a lot more input on what a potential boundary would be and what properties might be in and might be out. We need to do some more work on cessation support and how we'll provide that to, especially with our social service partners, and public education and outreach plan. Lots of people here to answer questions, so.
Thank you very much. Appreciate that. I did want to make one observation. My observation over at University of Oregon is there's a lot of perching on the median strip where you can't smoke anywhere else. People are perched on the median strip on a regular basis. I've got Mike and Claire in the queue. Mike?
Thank you. It's important for us to be clear about this stuff, because I think you're right. We know that smoking tobacco, that burning of tobacco, is the number one leading preventable cause of health problems and death. And getting people to stop smoking is a great idea. But when we don't talk about this stuff accurately, I think we do ourselves a disservice, especially as an organization. So when we talk about the title of this is Healthy Downtown and Public Smoking, there's a considerable health threat difference between indoor smoking and outdoor smoking. There's a considerable difference. Cigarette smoke offends nearly everybody. But outdoors, it's nowhere near the threat that a car driving by is to the air quality. And we have a regional air quality authority for monitoring such things and for protecting such things, because it's really important to us. But it is nowhere near the health threat of several other things in the environment. Outdoors. Indoors, I agree with the things that we have in place. So when we talk about creating a smoke-free downtown, it's not for the sake of keeping people healthy to ban smoking outdoors. It's to stop from some people being offended. And I don't believe that's the appropriate job of the city council, to keep people from being offended. So one of the reasons this is so important to me is because we spend a lot of money on public safety downtown, and guess what? We don't come close to doing the job. Right now, as of today, and please correct me if I'm wrong, Mr. Manager, we're prosecuting about half the number of citations that we did a year ago, because the city prosecutor's office has told the police downtown, we're going to change the way we do this, and we're not going to enforce the same level of citations downtown. So there's no way we're going to actually enforce this if we put it into place. And there are other offenses that are much more serious than this to public safety that we're not even prosecuting because we don't have the money. And keeping people from being offended must be lower on the list than some of the actual safety issues that we're not doing a good enough job addressing right now. So that's why I think we need to be careful about how we talk about this. Thank you.
Since you asked me to weigh in, I will weigh in. We have not asked our police officers to enforce any differently or issue citations any differently. What we do all know is we are in the process of looking at our community justice system, which includes prevention, intervention, and enforcement, as well as the prosecutor's office. So we are looking at the entire system, but we have not asked our officers to issue citations differently than the way they have been.
I would just, before I call in Claire, my comment is that I think smoking anywhere is a threat to health. Different levels, but a threat to health. In our downtown, people gather. They don't always just sweep through. There are people who meet with other people, that for people who sit down and have something to eat. There are people who spend a lot of time in the downtown, and they need to. And so it isn't. It is something that will impact those people. And there are children that come in our downtown, and it impacts the children as well. And I guess the other thing is, we'll hear more about this in the future, I feel sure, but my understanding, things we were thinking about is asking people to conform to the policy before taking any other action. If they conform to the policy when asked, that then you don't have to do anything else because they conform to the policy. And my other thing is that there are other ways to enforce other than using law enforcement, and I think that's under consideration as well. Just want to put those things out there.
I would just comment on that. What we've learned from the other communities is that education tends to be a really strong tool, and the pressure of just knowing it's smoke-free tends to be what stops people from smoking. We haven't found anywhere where it's been a law enforcement burden.
Claire?
Thank you. I really appreciate the comprehensive study of the issue and the report that was included in our packet, looking into this issue and how it's playing out in downtown. Renee, can you repeat what you mentioned about potential smoke-free parks and open space? I missed that. I know that's not the topic today, but I just...
Right. Parks and Open Space is pursuing a smoke-free parks and open space. They'll be doing the community review and input in July, hopefully, with a goal of having decision in September for implementation.
Great. Thank you. I look forward to hearing more about that. And there is definitely strong evidence that limiting people's opportunities to smoke reduces smoking overall and helps people to quit. So in terms of helping reduce those preventable deaths, it is a public health strategy that's been proven effective. And in terms of complaints I have received from downtown residents, and a small part of my ward covers downtown, secondhand smoke is among the main complaints I hear from downtown residents at the Downtown Neighborhood Association and other venues where I've spoken with downtown residents. I've had them ask me, when are we going to ban smoking downtown? At the same time, personally, I have some hesitation around imposing a blanket ban on smoking in public spaces that aren't specifically serving children. It is still a legal product, and the civil liberties aspect of the issue, although I would argue there is no constitutional right to smoke in public, is still compelling to me. So right now, I'm not ready to jump completely on the bandwagon and endorse this. I'm doing a little bit of a one hand and the other hand debate with myself. But that said, I do think that if we put this out to a public vote, it would pass overwhelmingly. I think there is strong public support for this kind of action. So I am very interested to hear what my fellow councilors have to say about this and what the public has to say about what approach they would support in terms of moving something forward along these lines. Thank you.
Greg?
Thank you, Mayor. One of the things I noticed that didn't come out in the report in the background materials was the issue of what the cost is of smoking in terms of basic health care, insurance rates, those kinds of things that affect us in other ways, the collateral effects of that. I wonder if there's anybody in the audience today that has some statistical data in terms of that.
We're phoning a friend.
We're coming up to it.
Good afternoon, Mayor and City Council. My name is Jennifer Jordan. I'm a senior community health analyst at Lane County Public Health, and I haven't just pulled up the data, but I can say that healthcare costs here in Lane County for tobacco-related illnesses from memory exceed $100 million a year, and I could pull up the exact number that's healthcare related, and then we have significant other costs in terms of lost productivity from tobacco as well.
Okay. Thank you. That helps a lot. I think that any way that we can begin to make a dent in those kinds of costs, as well as saving lives, not only directly for smokers, but also people who are affected by the collateral damage of smoking, whether that be secondhand smoke in the sector of what my esteemed colleague talked about in the areas of open air smoke. I think I have had enough emails from people who have expressed a deep concern about secondhand smoke in public areas and the effect it not only has on children but adults as well. Just passing through temporarily does not mean that you're not going to have some kind of effect, some kind of kickback effect from that smoke. And I know that I do, as just personally, as someone who has asthma and other allergies, that does have a tendency to aggravate those conditions that I have personally, as well as other people who have similar conditions. So, I think that overall we understand now what we didn't understand, in 1965 when my father passed away, the real deep damages of smoking, not just to the smoker themselves, but to the community at large. And I think it's incumbent upon us to be stewards of the community's public health in that we need to have legislation, effective ordinances that are going to protect the general community. And this, to me, is one of those no-brainers. I understand some people enjoy smoking. Some people get, kicks out of that. I also know that it is even more addicting than some of the street drugs that are out there. I've seen some statistics about its addiction rates in terms as opposed to heroin, cocaine, and other substances, that tobacco and nicotine are at the top of that list. So I may need another round, Mayor, but I see that my time is up.
Councilor Taylor?
Thank you. I have mainly questions right now, I guess. When we voted to ban smoking in public places, places of employment and so forth. The vote was 7-1. I was not the one that time. Though some people thought I would be when they read 7-1 because I do believe in individual liberties, but that was a different matter. I'm not sure how I would vote. I think this is a good idea. I even discussed it with the police chief a few years ago, the possibility. But, a comment, I know from people who have used drugs that I've heard, that I have known, and I've known a lot of people because I was a teacher for a long time, that it is more difficult to give up nicotine than other drugs. I've heard that a lot, that it's very difficult. And I don't think we're in the business of making people choose to give up things because they're not healthy for that reason alone, any more than we can tell people how many miles they should walk every day. It's a question of whether it's affecting other people. I did speak to a group of young people downtown one day near the bus station who were smoking, asked them what they would think about a ban. This is before Greg brought it up even, and I mean before he asked for a work session. And they thought about it for a little while, and they said, well, no, it's not good for us to be smoking here because little kids pass by and they might breathe it. And I thought that was interesting that came from some young people who were smoking. But questions I have, suppose someone works in the center of downtown who is a smoker, and where are they going to go? Are we going to say that we tell you can't smoke anymore? They could go outside now and have a smoke. That's just a question that doesn't need to be answered now, but it's a problem. And you mentioned the perimeters, and I guess that's it. Do you run, if you're on a break from work, do you run way to the edge of downtown and have a cigarette and then run back? Running would be good for you, but I think we should make a law that everybody has to run who can. Mike, need my glasses. I do agree there are other ways to enforce this. This is all random because I'm picking up on what other people said. Other ways to enforce. Another experience I had downtown, a young man was riding a skateboard on the sidewalk, and I said, please pick up your skateboard. And he said, okay, I will. And I do think that, I said it nicely, and I think that people can say, police, your smoke is bothering me, and people might, it wouldn't have to be the police who said it. I'm interested in what Mike said about safety issues we're ignoring. I don't know what they are, but I'll ask him later, or maybe he'll tell me later. I'm concerned about, another question, would we outlaw chewing tobacco?
Good question.
I know when my mother made my dad give up smoking when I was a young child, he started chewing, and he hid the chewing tobacco in an outhouse. And that's kind of unpleasant, too, to look at, but we'd have to put spittoons all over downtown, I guess, if we're going to have chewing tobacco instead of cigarettes. I'm really concerned about the smoking decks that taverns have put in. There's one in my neighborhood where they're following the law, I guess, but the neighbors whose backyards abut that property have to breathe the smoke. And we haven't done anything about that as far as I know. I've had a lot of complaints, which I've passed on to
Betty, you're out of time.
staff. Thank you.
Yep. George Foley.
Thank you. I guess I'm one of the 99%. I started smoking when I was 14. I used to borrow some from my mother's purse. I grew up in a house where people smoked. I remember going to the doctor's office and having the doctor in the exam room smoking a cigarette at the time. I smoked off and on until 1992, and I quit. Now, I can't get near cigarette smoke because my sinuses shut down. I get kind of sick feeling. So, I don't know if that's a psychological thing or if that's a medical thing or what it is, but to me, it's more offensive than anything else. Last week or week before, we had interviews at the atrium for boards and commissions. The first night I walked in front of the LCC building and into the atrium, the next night I had to walk through the alleyway by the garbage cans because the cigarette smoke emitting from the cigarette smoke odor emitting from in and around the library and the bus station was so overwhelming that it made everything shut down. On the other hand, if we continue down this road, I agree with Betty that there are people that smoke. It's their decision. We can't change their minds. It's not our job to change their minds. So we need to make sure that we look at maybe designated smoking areas to meet the needs of the people that choose to smoke, that don't want to quit, that can't quit. I can argue both sides right now. Having been a smoker, there's the old saying, "There's nothing worse than the next smoker." But I also understand that the people that are continuing to smoke, they've got their right to make their own decisions, and so when we address this issue, we need to make sure that we're actually addressing a health issue and not a behavior issue, because that's not our job. Our job is not to change people's behavior. And so we just need to be real careful how we approach this. And at this point, without any further information from input or suggestions from staff on possible wording, I could go either way on it right now.
George Brown.
Thanks, Mayor. I'd just like to ask a couple questions about Boulder. And I don't know how extensive your conversations or emails may have been with them, but you said, I'm just wondering if, I believe you mentioned they didn't have much of an enforcement problem. So that's what I'm kind of thinking about. If we come up with an ordinance that say you can't smoke downtown, who's going to enforce it, and will it be effective? My one question I have with this.
I don't remember the specifics of the date, but they did a very long public education outreach campaign, and none of them have reported. I mean, most of the smoke-free places reported back that the peer pressure is generally what works. I don't know if we could send more specifics about what we've learned from Boulder. I think the person who interviewed them is in the audience, but I'm not sure if that's all or not.
I see. Well, I'm just wondering, so now it's against the law. Somebody, let's say someone doesn't cooperate, and somebody says, well, hey, put your cig out. It's not cool. It's not legal anymore. There's a lot of people that their response will not be positive, and so does the policeman issue them a ticket, a citation, or?
I would like to share our experience with the library, because we have an enforcement basically on that block, and it is a conversation, and we get very good response from people once you have that initial because it's an education piece. But Ray from our the Reed group could answer that better.
Okay.
Hi, everybody. Ray Trotta, Reed Group, Portland. Can you repeat the question?
Well, I was just wondering if there's in Boulder, how involved are the police in issuing citations?
Sure. So as Sarah mentioned, they did have a very lengthy public outreach, public education. Traditionally, with these type of policies, you do a 90 days implementation where that continues the outreach that you did prior to the passage. And there is no enforcement, no ticketing going on in that time. And it takes about 90 days to get everyone on board, signs up, people comfortable with the policies. I'd also like to mention that, as you guys know, with the smoke-free workplace laws indoor, no one at this table is lighting up right now. And if you did, we would all know. At this point, it's been so long, we're also accustomed to these policies. They are effective, and we are essentially policing them at all times. And I don't believe that police have to enter into that policy very often. So amazingly, this is the way that most outdoor policies have worked as well. All the towns that have done it successfully have been really explicit about different different ways of showing the boundaries that have been designated. So, for example, I think in Burlington or Fort Collins, they did really explicit painting on the ground so people knew, okay, you're approaching an area, you're approaching an area. And we haven't heard from many that there have been enforcement issues or even complaints from the police. It becomes no different, as you had, Councilor Clark, as you had mentioned that normally downtown areas don't regulate things that are offensive, but downtown areas do regulate things that are offensive all the time. Open containers, dogs, skateboarding, biking, all different types of things. And we've all seen how those things go. There's a sign that says no biking in this area, and then the city decides how to proceed with such a policy. So I'd just like to mention that these smoke-free policies haven't gone much differently than other downtown ordinances. And that's what we've heard, that police haven't needed extra training because they're very used to this type of an interaction with the population and saying, hey, these things aren't allowed here.
I see. Yeah, okay, yeah, there is I think probably the worst problem area is at the bus station across from the library. It used to be really bad, as Renee Gruby said, that in front of the library it was terrible. I worked near there. I know very well what it's like day after day, but people just moved across the street to the bus station to join the crowd, the horde of people that was over there smoking and blocking the sidewalks. So it is a problem in certain key intersections in town. And I kind of agree with Councilor Poling, as if we keep pursuing this, I think that there are so many employees downtown still that smoke. And I think that there should be some designated smoking areas, a few, so somebody doesn't have to walk, 6 blocks on their break, their 15-minute break, to have a cig and then rush back. So I'm not sure exactly where those places would be or how that would work out, but even in this day and age, most airports don't have smoking zones, but some of them still do. Which, especially for long international flights, there'll be a designated area with fans and outtake fans and everything, and nobody else can smell it except in that room. So that's something I think we need to take into consideration. Thank you.
We've got just a few minutes left here. I've got 2 in the queue, and then we'll close up. And so I've got Mike and then Greg.
Thank you. There is something around this issue that I would love to see our city address, and I think we're in complete control of and can address, and it's this. The number of people who currently smoke downtown is large, and because there aren't a lot of public places, ashtrays, to put the remnants of what they've used, a lot of those end up in the street. And our street cleaners, as near as I understand it, have a policy of sweeping, and as they go down those storm drains, the cigarette butts end up in a river. And I know a lot of people with real concerns about the number of cigarette butts every year that our city is intentionally, for lack of a better way of dealing with it, putting into the river. So I don't know what it would take with regard to public works policy and how the street sweepers operate so that we don't end up with as many cigarette butts down the drain and in the river, but I'd certainly support that. And then, well, I'm going to leave it at that because it doesn't sound like this group is ready to outlaw that, but I think there are a number of things that anybody can experience walking through our downtown park right out that window every single day in the afternoon that I'd rather see us stop doing than this. So, thank you.
Greg.
Yeah. Thank you, Mayor. I'd like to point out that some of the strategies that are being talked about around this policy, I think, are less draconian than what people may imagine. One of the policies that we're talking about is a smoking cessation program that will, divert people who, are involved in smoking to a place where they can begin to get off smoking and not necessarily being ticketed and fined for smoking. I think that yes, we need to have designated areas for smokers. We also need to have a situation, or at least a time period, where there are restaurants and bars that, where people do, smoke, and there are times when you don't have a majority of the public being downtown in those areas during those times, say from 10 at night to 2 in the morning. And also, I think that there's a strong contingent of a number of different constituencies who would support a no smoking policy in downtown, including Lane Transit District, including the business community, and many members of the Chamber of Commerce that I've spoken with. The police supports this policy. We also have Peace Health looking at their university campus, which is outside of the downtown area, but would also support a policy of this nature for their area, as well as the University of Oregon, which I talked to a couple of people over there in the health division there, and they were very supportive of also extending their smoking policy to include public sidewalks and areas directly adjacent to the university. And so I think that what we can do is, this is the beginning of us crafting a policy, I think, that would be beneficial to people, whether they are smokers or not smokers, but beneficial to the entire community. So I really think that we need to have at least another work session on this, and that we have some of those options and policy pieces that are outlined on the table as to how we can craft a policy that I think would be beneficial for all of the people of the city of Eugene, as well as people that are coming into our community and engaging our community as visitors and other things of that nature. So I'm really excited. I think that we have a robust discussion beginning, and I'm really thinking that, maybe we can get somewhere with this.
Thank you all for the presentation. Thank you for being here.